Hi guys, I'm Dr. Heather Hirsch. Welcome back to my channel, Health by Heather Hirsch, where we talk all things menopause and midlife because it is my passion to bring you the most up-to-date education and information from someone who is trained and well-versed in all things menopause and midlife. This video is going to be all about hair. Hair is one of the most common questions I get from women, and interestingly, they feel very either embarrassed or ashamed to admit that this bothers them. Now, not everyone. My overarching theme is always that not one size fits all, and not all of you are the same. But people really worry about their hair loss, and I absolutely get it. When we're postpartum, that's another time our estrogen level is crashing. We can lose hair then, and I very distinctly remember all the baby hairs that were coming in and just feeling like just not my best self. Now, it can be hair thinning, it can be it can look like balding, it can just be where you brush your hair and you feel so many pieces of your strands fall out. It is very bothersome to most women. Now, let's talk about, at least from my perspective, what types of reasons we have for hair loss. It's complex and there's many. A bona fide dermatologist would probably also be a good person to have in this video, but when we're talking specifically about hair loss and menopause, we do know that the loss of estrogen, which is the hormone that you lose when you go through menopause, can definitely trigger hair loss, and it can be really distressing. Now, hormone therapy is not FDA approved to treat hair, but as a side effect, if you are taking it for other things like hot flashes, genitourinary syndrome of menopause, or vulvovaginal atrophy, if you're taking it for night awakenings, if you're taking it for osteopenia, it can definitely improve your hair. So estrogen is just really good for hair growth. If you were ever pregnant, you may remember, sort of that tons of hair and you felt really great, and that's sort of those high levels of estrogen helping your hair. What else can you do if you are not taking hormone therapy? I always recommend starting with your doctor, making sure it's not another medical condition. There are definitely medical conditions that can cause hair loss and hair thinning. So a thyroid disorder is a biggie, either hypothyroid or hyperthyroid. So both of those should be checked. And I would also maybe recommend you check a free T4, maybe a free T3. Make sure it's not a subclinical hypothyroid or a subclinical hypothyroid. So you want to check those as well. You might also want to check a parathyroid. You may want to check an A1C for diabetes, just a chemistry panel, and some other really important markers can be helpful, such as zinc, iron. Those can all be low if you're losing your hair, and so anything you can do to replace those is really good. I'd throw in a vitamin D, although I don't think there's much evidence that vitamin D really has a direct link to hair, but it's such a good one to check while you're at it. I would check an estradiol and an FSH as well, because if the FSH is high and the estrogen is low, it could be from menopause, of course. What can you do, if you're not taking hormone therapy? Well, over the counter, a lot of women will take biotin. Biotin is really good for hair, skin, and nails, and that is just some nice supplements you can do to increase your hair. Another good one is Rogaine foam for women. Now, you have to really stick with it, so you have to use it for about 6 full months to see if you see any changes in your hair, but Rogaine for women can be a really good option. There are also other medications that are non-hormonal that dermatologists sometimes will use to see if they can get some hair to regrow, and you definitely want to talk to your doctor about those because they do carry some risks. So talk to your doctor is just a great place to start. And dermatologists, which I am not, are really working very hard at new options for hair. I know they're doing injections and they're doing hair transplants, and I think a ton of wonderful things. So just because you go into menopause, number one, I want to advocate for you that if you feel like you're losing your hair and it is bothersome to you, it's okay to talk to your doctor about it, because there potentially are things that we can do to improve it. There's labs that we can check, and those should definitely be checked to make sure there's not an underlying medical cause. If those labs are normal and there's not an underlying medical cause per se, but you are menopausal, it could definitely be menopause. Hormone therapy is not FDA approved for hair loss, but if you're using it for something else, it can help. And again, there are medications that are oral medications that can be used, as well as dermatologists who might have some really great recommendations for you. So just a little bit there on hair. It's something that all of us think about and something that makes us feel like us. So thanks you guys so much for listening in. If you like this video, please like and subscribe. That way I know that you like this content. Leave me comments. What have you done? What have you tried? What other videos would you guys like to see? I hope to see you again soon. Bye everyone. Have a great, wonderful day or evening.